The broadcast is now starting. All attendees are in listen-only mode.
Good morning and good afternoon. Welcome to the webinar titled Impact of the Recent 28 Million Settlement on Cybersecurity Risk Management and What You Should Do About It. My name is Anupam Sahai. I'm co-founder and CEO of Aegify Incorporated. Have been in the areas of healthcare IT, cloud computing, security, and compliance for 20 plus years, and have been speaking at multiple conferences and webinars. So the agenda for today, we will first talk about what happened at the St. Joseph Health Medical Systems. The $28 million settlement was done at this facility of multiple hospital systems. We will talk about how the recent HIPAA changes impact the covered entities and business associates going forward. There have been some significant changes, and we will also go over the topic of how could these fines be avoided by St. Joseph's Health, and what steps were recommended by the government to ensure that this does not happen again. And then at the end, we'll have Q&A. I would encourage you to ask your questions. You can write down your questions in the question section of GoToWebinar, and we would look forward to hearing and getting your questions answered. The webinar recording will also be sent out to you over the next few business days, and please do let us know what your feedback is. So let's get started. So let's recap as to what happened at St. Joseph Health System. So there was a breach that took place in 2012, and that resulted in the government fining them for the HIPAA breach, and there was a patient lawsuit that followed, which essentially resulted in the settlement from a patient redressal perspective, and the settlement was worth $28 million, which accounts to about for the 32,000 breaches records that were breached. The settlement of $28 million was broken down into 4 different components. There was a cash payout of $7.5 million, which amounts to about $242 per record. There was $3 million in reimbursements that was affected, and the purpose of this reimbursement money was to pay back any actual damages that might have happened because of the breach. Then the government required St. Joseph Health System to invest $13 million in various security investments that I'll talk about, and then $4.5 million was spent in providing ID theft monitoring services to all the patients that were affected. So if you add this up, this all amounts to $28 million worth of the settlement, which is a pretty hefty fine from a patient lawsuit perspective. And the primary reasons why they were fined or they were sued and the lawsuits were upheld was that the St. Joseph's Health System had failed to have a comprehensive information security program in place. They lacked security controls for HIPAA. There was no security risk analysis done organization-wide, which is again a precursor to having a robust security program. And so all of this resulted in their SharePoint site being leaking information about all the patients, the 32,000 patients that were searchable on Google and accessible via Google searches, where you could see the patient names, the patient history, and their health records. So that's pretty damning. So let's take a step back and figure out, was this an isolated case, or this is actually one of the many instances where things are coming to the fore. I was at the SCCA conference yesterday. This is the healthcare compliance conference, and one of the questions asked by the director of OCR, Office of Civil Rights, was he was asking the audience regarding how many of you have been breached, and literally 90% of the hands went up. And then he said, for the 10% that haven't raised their hands, you might have been breached, but you may not be aware of it. So the problem is very rampant, and this is a huge nightmarish issue for the healthcare industry, primarily because the cyber attackers are targeting the healthcare industry. If you look at 2015 data, 66% of all healthcare breaches targeted healthcare, resulting in hundreds of billions of dollars of losses. And the reason is pretty simple. The value of the healthcare record is the highest. It's about 5 to 10x compared to anything else, and so that becomes a prime target for the attackers. Now, the attackers could be insiders, or they could be external hackers who are going after valuable information. And if you look at some of the recent healthcare breaches that have happened, Anthem Blue Cross, 78 million, Premera Blue Cross, 11 million, and so on and so forth. Roughly about 112 million records were breached in 2015 alone, which is roughly about 1/3 of the US population, mind you, in 1 year. So this is a huge, huge problem that every organization is grappling with. The other angle to this is that the government now has a huge enforcement stick, which allows it to ensure that every covered entity and their business associates are HIPAA compliant. And there are some new requirements that have been put together by the government, which require both covered entities and business associates to be HIPAA compliant. They need to make sure that they're doing security risk analysis and ensuring that any BAs and vendors that they work with are indeed HIPAA compliant as well. In fact, during the SCCA summit yesterday, the 3 top priorities that the Office of Civil Rights enunciated was, one was to make sure that BA oversight programs are in place. Secondly, that cybersecurity programs and information security program is in place in a covered entity. And the third was to perform security risk analysis. So this is kind of bubbled up to the top as being the top concerns that every organization and the enforcement agency like OCR is going to be looking at this year. So what is at stake? It's really what we call the triple whammy. So if you get breached, the government will fine you because you have violated, if you haven't put together the HIPAA security controls and don't have a security program in place, the government will fine you. There will be patient lawsuits like the St. Joseph Health System patient lawsuit, which can run into millions, if not billions of dollars, depending on the number of records breached. And of course, brand damage, which has huge implications in terms of patients trusting you that the information is going to be secure. So you can see here some of the recent fines and enforcements that the government has put together, which includes government fines and the patient lawsuits that happen. And the government has been pretty proactive. You can see here in 2013, they proposed corrective action for about 3,400 businesses roughly. There's also a cybersecurity bill that is going through the various processes to ensure that it covers the healthcare requirements from a cyber attack perspective, but that's a little early in the stage. So what could have been done by St. Joseph's Health System to avoid these fines, to avoid these breaches from happening? They actually missed some very simple things that are that need to be done and is recommended by HIPAA. The first thing is that there's a need to have a basic information security program using HIPAA or the NIST cybersecurity framework or SANS 20. And all of these are recommended by the Office of Civil Rights. The HIPAA security controls are pretty comprehensive and robust. SANS 20 is a general purpose cybersecurity hardening framework that allows you to make sure that everybody in the organization is handling the information in the manner that they are assigned to. So any of these frameworks will get you there. You need to have at least one framework that you're picking and implementing it. And there needs to be a way to implement the framework using a GRC tool, governance, risk, and compliance tool, to ensure that you're assessing application and the system security. They did not have a chief security officer, so there was no point person or responsible person, go-to person for ensuring that things get done. And that's always a problem because things fall through the cracks otherwise. They did not have security training programs. So somebody put up the patient's information on a SharePoint portal, which was facing the public internet. And that meant that Google picked it up and indexed it, and it was available for search through the Google search engine, which is a bad thing. So having basic security training programs allows you to manage and make sure that that anybody who's handling PHI information knows what the do's and don'ts are, and then they can take steps to ensure that things are not accidentally shared with the external world. They did not have an organization-wide security risk analysis done. So the risk analysis allows you to understand and assess the robustness of the information security program, and gives you a risk estimate for what is the risk exposure that the organization has to various threats and vulnerabilities. And that was not done, and thereby some of these information leaked out. And then there is a need to put together a comprehensive BA vendor management program so that you're able to not only ensure that the data, the patient information is secure inside your company, but it should also be secure downstream with any other vendors and business associates that you're sharing the information with. So you have to make sure that the PHI information is secure inside the company and externally as you share it with anybody else. And then making sure that this is done in an ongoing fashion. Security and compliance is a journey. It's not a point in time. So it's important to put these programs in place, but it's also important to refresh and update to ensure that you're staying on top of any changes that happen. There might be new employees coming in, new devices, new assets, new laptops coming in, or employees leaving. So it's important to manage the process and the changes that are happening and reflect that in your organization so that unauthorized persons don't have access to the information, for example. So all of these are part and parcel of a robust information security program, and continuous monitoring is needed to ensure that you're staying on top of any changes. So St. Joseph's Medical Hospital system were missing some of these building blocks, basic building blocks that are needed to implement and ensure that the security program implementation was robust. Not to mention that some of the basic HIPAA requirements were not being met. So if you look into the security risk analysis requirement, this is basically what HIPAA says, that this is again mandated by HIPAA, where you're required to look at all of the risk and vulnerabilities that that might potentially expose protected health information. And protected health information can be in electronic format or it can be in physical format. It doesn't matter. As long as you as an organization have access to important patient information, they need to be protected one way or the other. Now, I won't go into this in detail, but this is kind of a risk management framework that allows you to manage all the risk and the risk factors that contribute to estimating and assessing risk in an organization. So basically, in brief, the different contributing factors are the various threats that exploit different vulnerabilities to create an impact, and the security controls are the ones that are posing these threat actors from exploiting and compromising these assets. So you have to look at risk and assess risk in an organization in a holistic manner. And if you have robust security program in place, then you're able to do that and minimize your risk. So how are most covered entities doing this today? So if you look at the current landscape of solutions out there, it's very siloed and fragmented. There are solutions, point solutions that are available for doing risk only or for just for security scanning or for compliance management. And they are really fragmented. The burden of understanding and interpreting the results is left to the end user, and it's confusing. Or there are spreadsheets and manual surveys which can be error prone and very expensive and time consuming. And continuous monitoring is a challenge, especially with these manual tools or fragmented tools. So we have a webinar scheduled this upcoming Friday where we will talk about Aegify RSC Suite. And so I won't cover this today, but just suffice it to say that you can use the Aegify Risk Security Compliance Suite to implement and deal with all the problems that St. Joseph's Medical Systems faced. And you can put together a detailed information security program. You can do security risk analysis and automate the entire process of continuous monitoring. So with that, let me close by saying that, as I said earlier, HIPAA enforcements are ramping up. Their government is becoming very aggressive to ensure and enforce the HIPAA requirements. And in fact, Office of Civil Rights has launched a phase 2 audit program. They mentioned that initial letters have already been sent out to all the healthcare organizations that will be audited this year. And as a covered entity, it's important that you implement a comprehensive information security program that's robust. You do risk analysis to ensure that you are staying on top of understanding what your gaps are, open issues are, and you do that internally and also with your vendors and business associates to make sure that the information that you're sharing downstream with your business associates and vendors are indeed safe and secure. And then make sure that you have an audit trail for all of your communications, so that this is critical, because if Office of Civil Rights or any external auditor comes knocking, you are able to show the proof of what is called reasonable efforts. Thereby, you can state that you've put together these programs and you've made efforts to ensure that all of your stakeholders inside the company or outside external BAs and vendors are indeed aware of what the requirements are and all that, provide the evidence for that. And use automated tools that can aid and make this process efficient and effective. And as I said, we'll talk about Aegify, which is one such automated tool. In fact, the only automated tool that unifies and provides a completely integrated view of risk security and compliance in a unified dashboard. So let me stop here, pause here, and see whether there are any questions so far. Please type in your questions in the questions area of GoToWebinar, and we'll be happy to answer any questions that you have. Okay, so the first question is, how was the data leaked to the internet? Can you explain that? So the way it happened was that the patient electronic medical records of the patients were posted on an internal website. This was their SharePoint portal that was used internally, but it was not configured properly and it was exposed to external users. And Google search engine was able to access that information and thereby anybody searching on the internet for those patients were able to see the complete medical history and records. So it was a combination of technology error plus lack of training and lack of putting together basic information security controls that resulted in the leak of the information, and thereby the fines and the patient lawsuits that resulted from that. Okay, so next question is, how common are breaches and should I be worried? So as I mentioned earlier, these breaches are very rampant. If you look at some of the recent breaches, these are the notable high-end breaches, but roughly about 112 million records were breached in 2015 alone, and the rate at which the records are being breached this year in 2016 is at a much higher pace. So literally every healthcare organization that has patient critical information either has been breached or will be breached shortly if you're not aware that you've been breached, and this is coming from the OCR director. So it's a very severe problem, and as a healthcare organization, while you're not assumed to be perfect and impervious to breaches, the expectation is that you put together the basic HIPAA security, information security program with basic set of tools and processes in place to ensure that the data cannot be breached accidentally. Now, does it mean that you will not get breached? Possibly not, because there are still chances that somebody might come in and break open the data, but the probability of getting breached is much, much lower. And the government will, and the patient lawsuits can thereby be less imposing because you've taken steps to ensure and show that you're HIPAA compliant. So it's very important for organizations to become HIPAA compliant, to ensure that they are taking steps to deal with all the HIPAA security and privacy requirements. Any other questions? So if you are interested in getting a copy of the slides, please reach out to me. I'll be happy to share them with you. If you would like to join the next webinar on April 22nd, you can access it on this URL. You can see the webinars page on aegify.com. We have the security manager demo that will talk about how to address the $28 million lawsuit scenario and what St. Joseph's Medical System could have used to prevent such breaches from happening. We have a number of other webinars that are coming up, as you can see here, and you can register for some or all of these. We expect, we thank you very much for coming today. Appreciate your time. And please do let us know your feedback. If you have any suggestions for topics, we would love to hear back from you. Otherwise, thank you and have a great day. Bye for now.